A fungus has been spreading in Michigan healthcare facilities for the past few years. It's resistant to drugs and could cause severe illness for already very sick patients.
I spoke to the state's top doctor about what this means for Michiganders.
It makes its way into a healthcare facility, and then it can be very hard to get rid of.
That's Dr. Natasha Bagdasarian, Michigan's chief medical officer. She's talking about the fungus Candida auris, a drug-resistant type of yeast.
This is a growing problem that we have been seeing here in Michigan since about 2022.
She says the fungus can cause severe illness and spread easily among very sick patients, often evading routine cleaning and disinfection.
People who tend to have a lot of devices, so indwelling IV lines, dialysis catheters, things like that. So it causes problems for people who generally are more ill and have more of those other things going on.
But there is one point she wants to make clear.
So this particular organism is likely not going to impact, any of your viewers who are watching this broadcast right now. But there is a bigger issue at hand, and that's antimicrobial resistance. We know that there are more bacteria, more fungi, more of these microorganisms that are becoming resistant to treatments.
She calls antimicrobial resistance a global problem for human and even animal health, too. As for Candida auris, the fungus has been recorded more than 2,200 times in Michigan since early 2022, primarily in southeast Michigan. But Bagdasarian says it is emerging west and south with 13 recorded cases in Kent County.
So if it's living on your skin and it's not causing an infection, it doesn't necessarily need to be treated. It's when it gets into someone's bloodstream or gets into another sterile site, gets into a wound and causes a wound infection, that then we have to think about how to treat it.
So, Elena, what's causing this drug resistance?
So it's over-prescribing antimicrobials. So Dr. Bagdasarian says those in healthcare are actually already doing this practice called antimicrobial stewardship. So that means they're making sure that anyone who doesn't need, like an antibiotic doesn't actually have one. So they're hoping that they can, stop this overuse and stop these organisms from becoming resistant to drugs.
It's really scary.
Yeah, it can be.